Let's go to 2019, where we're looking at different implant designs, like an inverted body design with a subcrestal angle correction. And when we look at these implants, they are designed to go in with higher insertion torque than the ones placed in the previous study. But what we see, because of this narrow top and most of that top not in contact with any bone, is ISQ values are not always very high. And those that believe in a correlation existing certainly would be disappointed by these findings. But if we look at an example here of a canine tooth where we had insertion torque of 40 Newton centimeters, we immediately provisionalize the implant. And what we find at almost 3 months is a dramatic increase in ISQ, which has really been consistent throughout this entire study. And remember, a 10-point jump in ISQ readings correlates to about a 50% increase in terms of micromotion being decreased. So this is very favorable, and so these patients are proceeding on to screw-retained final restorations at 12 to 14 weeks, predictably. Now, why is this important? Well, we're trying to avoid complications, and certainly cement is one complicating factor that we'd like to avoid. Using an implant with a subcrestal angle correction correlates with what Dale Howe showed us, that the difference in long axis of the crown and the root of an anterior tooth is about 10 degrees. And so if an implant is placed, a straight implant is placed for cingulum axis, David Cochran's group showed almost an 82% likelihood of perforating that facial plate in an apical position. And so by putting these implants in towards the palate, we're still able to achieve screw retention. But how do we know that we're in the right direction here? How do we know these implants are osseointegrating when such a significant portion is not in contact with bone? And I always take my ISQ reading before grafting, so there's no confounding factor in terms of, does the bone graft material help to possibly stabilize the implant and give me a false sense of security in terms of what my ISQ really is.